So my name is Lynae Brayboy. I'm a physician and scientist. I'm an oocyte biologist, as well as a reproductive endocrinologist and specialist in fertility. And I also am the co-founder of Ovom Care.
Hi, my name is Felicia. I am the CEO and co-founder of Ovom Care, and on campus already since July 2022.
So Ovom Care is a hybrid IVF clinic, and we leverage AI tools to improve IVF outcomes. We hope that our AI tools improve not only the patient experience, but accessibility and success rates, meaning live birth rates.
We are a hybrid care provider. That means that we are crazy enough to actually build fertility clinics, but we also build a technology stack, a technology ecosystem, where we now build the technology to support patients across their journey through fertility treatments. So the fertility journey, or maybe let me start differently, the kind of patient that we support are twofold. On the one hand side, it is for fertility treatment where we need to support patients in being able to conceive. IVF treatments in particular. There's all different kinds of IVF treatments. We support all of them. We focus a lot on inclusivity and diversity, supporting every human to the degree that it is necessary, and that's also adjusted to their personal journey. On the other hand, we focus on fertility preservation, freezing our eggs, freezing sperm, freezing embryos. That also is the case in many scenarios. So when you talk about what are the different journeys, what is the journey that we support, that it is right now at the moment, but we go beyond that. We envision reproductive care not just as fertility treatment, not just IVF, not just egg freezing. It's much broader than that. It starts as early as contraception. It goes into natural family planning, avoiding IVF as much as necessary, as much as possible at this kind. And then going up to the point of menopause and really going with you your journey when it comes to your reproductive potential from a very young age to a very old one.
I think what was missing from a lot of period tracking apps is, what do you do now? You found that you have this pattern, you found that you have this data, but what do you do with it? Usually people bring it to their physician, and their physician goes, okay, nice, great. They may be able to act on the data, they may not. But I think the whole point of Ovum is that we want to leverage the data to understand not only about you sitting in front of us, but other women like you. Because I think when you think about women's health care, it's lacking data, it's lacking research, it's lacking innovation. And having that data siloed in one company is not great, but having the ability to use things like the Oura Ring, like trackers, like LH strips, all of those things, put them in a cloud and understand what do they actually provide, how does that track to their outcomes, their reproductive outcomes, when they actually do get care. No one's done that before, and that's what we are seeking to do at Ovum. Here's the thing, is that we don't have enough data. So when I say we don't have data, we've got zero. We've got goose eggs. So when we think about how we manage people in our clinical guidelines, that comes from studies that might have, woohoo, 1,000 people in them. And we congratulate those studies. We go, wow, what a great sample size you have. But what if we had 3 million data points about a person who was in a study? What if those 1,000 people had 3 million data points, which you can get from cycle tracking, which you can get from someone going through, let's say, an IVF cycle, which you can get from someone logging if they're tracking their symptoms? This is what we're missing in medicine, and we're kind of blind to it because we haven't had the tools in medicine. And what we want to do at Ovum Care is really integrate that not only into, oh, that's nice to have, it's nice to visualize your data, but how does that change how we manage the patient? And I think that's the problem. It takes so long, for instance, for us to find out, okay, oh, maybe this is a new innovation, because we're doing it in a very manual way. Research takes a long time, as I told you. Even with my own research history, it took from 2008 to 2013 just to get the grant, and then it took from 2013 and 2017 almost to publish and get the data out. So what if you had more data? What could you do? And I think the possibilities are limitless.
When you look into fertility industry today, it is very subjective. You go to 3 different clinics, you get 3 different opinions from 3 different doctors. What we do is we bring in data-driven decision-making to fertility care, which allows us now, and this is really the core of that, to go in an era with personalized precision medicine. When you look into the fertility journey of a patient, egg freezing, IVF, choose whatever. There's multiple decision points across that journey. The doctor is making decisions for you. What's the right medication? What's the right dosage? What's the right timing? Which embryo is the best one? Which egg is the best one? All those decisions are primarily subjective at the moment. The doctor is deciding based on their experience. What we do is we add the layer of AI, we add the layer of data-driven decision making, because now what we can do is we create a data infrastructure which allows us to make predictions. For you, we should be taking decision A over B, because now your success chance with that option A is much greater compared to option B. And by that, we're not just tailoring every single journey to every single human being that's working with us, but also boost and maximize your specific chances in achieving whatever your goal might be.
So in a traditional IVF clinic, maybe you see an ad in the subway or online or in the newspaper, you hear it on Spotify, and then you give the office a call and you give them all your information, you book your appointment, and then you drive in or you take the subway in, and then you sit there and someone talks to you and you pay them, and then you decide whether you want to go on with care. Maybe you do diagnostics and then you go on with care. And it's a lot of email, a lot of telephone calls. Maybe the nurse calls you while you're in the middle of giving a talk, or you're having an interview and you can't pick up, and the nurse is saying, oh, make sure you do this and do that. And we wanted to just turn the experience on its head, because that's not very patient-centered. If I have to chase you to get information about my care, that's difficult. So instead, we wanted to allow patients to not have their lives disrupted, so that they could actually start their care experience in the comfort of their home on their couch and only come in for what is necessary. And that's the model today. What we want to do in the future is completely revolutionary. We want people not to have to come in until they have to do the sentinel event, which is usually an egg retrieval, which is then usually an embryo transfer. So today at Ovum, people will go on our website, or they'll see an ad, they'll click a link, and then they can automatically have a free introductory educational call with me, with a clinician, not with a salesperson, not with someone who hasn't been trained, but with an actual clinician, and also my colleagues. And we'll go through, what is IVF, how does it work, so that they can have all their questions answered before they invest the time and the money, the resources, into doing a cycle. And then afterwards, we get them onto our app, which is free, no obligation. Then they can upload all their records. You have no idea how it works in a traditional clinic, where you have to come in with your stack of papers and show people, this was my lab from last week and this was my lab from 2 years ago, and it's a mess. And so in the future, we'll have an AI tool that can read all of that and extract the necessary data that needs to come out of those records, and have that pre-populated to a note, so that when your clinician now is seeing you, that's going to be your treating physician, they already know everything about you. Now it's a conversation. Now it's shared decision making, as opposed to, now when was your last menstrual period? And this is why the tracking is important. Having all of that data, people have years and years of tracked data. Why not take that data into consideration and be able to visualize it and see, oh wow, your periods actually have been shortening. Oh wow, your flow has been getting lighter. Oh wow, this is a new symptom for you that you might be experiencing. And this is how we now can intervene earlier as opposed to later. Okay, when you've already now perhaps gone into menopause prematurely, or maybe when you already have a more advanced disease than when you potentially could have come in earlier. I don't think it's difficult. I think it's also about the people, right? The company is the people. So my colleagues are clinicians who are veterans who've been in this industry. They're also compassionate people. And it's actually not that hard to teach a clinician who's interested how to use tech. And so people who've been using maybe antiquated ways in their other jobs have now come onto the team, and they're really excited to use tech to reach the patients and to have a better experience. So for me, I'm not administering the everyday care, but I'm helping the team to make sure that they are delivering the high quality care. And we really want to know what the patient experienced. So every patient is offered an exit interview, so that they can go over and tell us what they liked, what they'd like to change, and how we can do better. And for me, managing it, being a tech founder, it's kind of what I've always done. I've always been on my phone. I've always been on my computer. But now it's for a higher goal, a higher mission, and also to drive R&D so that we can offer better quality care, not tomorrow, but maybe 5 years from now, based on the AI tools and also the innovations that Ovum will bring forth. Well, I think, when you say European versus American, you're saying like huge versus huge, right? I mean, even in different states, healthcare is administered in different ways in the United States. some things that are legal across the border are illegal right, in another state. It's the same in the EU, unfortunately. And when we talk about reproductive health care, oh God, it's a landmine for patients because, what is allowed in, let's say, the Czech Republic is not allowed in Sweden, which is not allowed in Spain. And so it's a minefield. And what we want to do at Ovum is really allow people to have the families they want on the terms they want, kind of sidestepping all of the things that the government, the patriarchy, society has imposed on the laws of the land. I mean, we're having a battle right now. The right to IVF in the United States is not being protected, despite whatever a politician might say before a debate about protecting IVF. We've already eroded our basic reproductive rights. I would say in the EU, you can still have access to contraception so that you can have a child when you want. In the EU, some people have access to egg freezing. That's not universal in the United States. In the EU, there is some access to IVF, although it's very restrictive and very limited. In the US, it's only about half the states that have any type of mandate. So I think there are some differences, but the underlying thing is that, the government is not necessarily thinking about women's rights. They're not thinking about reproductive justice. They're not thinking of LGBTQIA communities when these laws are written. And so it makes it very exclusionary, very discriminatory for the majority of people who need IVF.
When we look into the reproductive care industry as a whole, not just fertility, but reproductive care as a whole, we see a couple of challenges. One of them being we have very low success rates still when it comes to fertility treatment. And they have stayed low the past couple of years. There hasn't been a significant uptick, despite the development of technology, despite research going on. So what we do is we bring technology to maximize no success chances for every patient, overcoming these subjectivity, as I mentioned before. The second huge aspect in the whole fertility industry, reproductive care industry, is accessibility. Fertility care is crazy expensive. Sometimes it's funded by the government, it's supported by the government. In Germany, for example, it's 50% of the first 3 IVF cycles that you go through. But in many other scenarios, it's not supported at all. And then IVF is very expensive. It starts from about 5,000 euros going up to 10,000 euros for one cycle only. Success chances, however, dictate that you need, on average, 3 cycles, maybe even more. So it's not accessible for most of the people out there. So we also strive to use technology to reduce the resources needed to actually provide that service and then pass on that cost efficiency to the patient to lower the cost itself. Secondly, what we're burning for, which is absolutely necessary in overall healthcare, is value-based pricing. You shouldn't be paying for something that's not resulting in success, right? So what we introduce, same here, also based on data and algorithms, success-based pricing. You only pay if you actually achieve your goal. The third element that we see, and I think that is the one closest to my heart, is there's a very limited patient centricity in that whole industry. You feel like a number in the system. You feel like you get the same treatment as everyone before you. It's not someone that is focusing on you and your journey. What do you actually want? What is your potential? How can we help you? It's almost the other way around, that the patient needs to run around the clinic, call, write emails, please answer me, please help me. It should be the other way around. It should be that we have a trusted partner by our side that is helping us through that incredibly emotionally difficult time when it comes to your reproductive care. I think one of the biggest challenges that I see is in regards of regulation. Regulation is intensifying for a reason. I completely agree to that. We need to have ground rules how to use that new technology because it is incredibly powerful. We're just seeing, the teeny tiny bit of what it can do. There's so much more that will come from that. So we need to set a framework. I completely agree. The primary challenge that I see from my industry specific is that we have different regulatory frameworks across different countries, which makes it difficult for a company also to expand services from, across the European center, but also then beyond Europe. So it's very tricky for us having those differences between the US, between Europe, within Europe, et cetera, et cetera. So that's probably the main challenge that I see at the moment when it comes to AI specifically. What I would also like to highlight is what we need to look out for is expectation management and the reality when it comes to AI and what we are building at the moment. AI is powerful. What we've seen in the past 12, 18 months developing is absolutely insane and incredible. The added value is gigantic, but it's also still the very beginning of it. There's a lot of hype out there. AI will do that, it will transform our life. We need time to also get there. We need the data to get there. We need to set the frameworks to get there in a safe manner. Not slowing us down, that's definitely not what I would want, but giving us the frameworks to get there in a structured manner and not just, running in 10 directions while 9 directions are the wrong directions.
So I definitely think, to answer your question, that AI can help democratize care. One, we can help people have earlier education and access. So right now I do individual talks, but we're starting to do webinars, we're starting to do videos and produce content that gives people the option to know about their bodies. That's how I started in tech. We should all know some fundamental education about how reproduction works, so that if you are now 30 seeing this information for free, you don't have to wait until you're 40 to go, oh wow, I didn't know, no one told me. So that's number one. And AI can help with that because I can't say it in every language. I can't be everywhere. I can't be at every conference. And so that's the benefit of tech. The other thing is that we can look at pricing models that help people in their locale, right? So right now we have a clinic that's already open and functional in London, and that has one price point in London. But in Portugal, where we're opening soon, we have a very different price point. And so people can contrast and compare online without leaving, without having to take off work, really what they want to do. And so that's accessibility, which is a big, big issue. Also, having different clinics in different places, we can offer things that are maybe not offered in one clinic, and having that information readily available is also helpful. But the future, I want to get to the future, is that AI tools can really revolutionize the way that we look at human gametes. And so we're already using the tools that are cutting edge, that are on the market today, but our R&D is really interested in looking at even a deeper layer, and AI is the only way to do that. How do you process 1 million data points from one cell and have that reflect what's happening in the clinical outcomes? So there's a lot of ways that AI helps. It gives transparency also to the patient, so that say you go through a cycle and you don't have the outcome that you want, you're not able to get pregnant, but why? The why is always difficult for patients, right? Because a lot of IVF clinics just say, oh, just cycle again, but people don't have unlimited resources and unlimited time. And so now if you know that your eggs are poor quality, maybe you decide, okay, I want to do egg donation. This is what I have money left over to do. Or maybe you decide I want to adopt. And having that empowerment allows you to have more control over something that's been wrested from you, because people do feel like they're out of control when now they can't have a child when they want to have a child.
So as mentioned, I joined the campus in July 2022. I celebrated my 2-year anniversary a while ago. Very happy to be here, by the way, still so. I joined the campus as a founder in residence within the Merantix ecosystem. I joined Adrian and Rasmus on that quest, and let's build AI companies to make the world a teeny tiny bit better with one company at a time. And I was, for my first 6 months, I was with Merantix, and then transitioning into Ovom Care as we incorporate the company. When it comes to synergies, we started the company, as mentioned, early 2023. So as a young company, you try to get all the resources that you can get, all the help you can get, all the support you can get. And the campus is full of support, of people that have been through the process before. Not just investors which are on campus, but other ventures that have been through the journey, that have been building healthcare companies, have been building AI companies, because there's so many roadblockers out there, it's insane. So you speak with them, you engage with other founders, you engage with other team members, which help you to see things that you didn't see, to help you avoid mistakes as much as possible. We are right now sharing an office with another company, which is also funded by the Merantix ecosystem. The company is called Deltia. They are a company which is even more deep tech than we are, and there's been incredible synergistic relationships between my tech team, which is here in Berlin, and their tech team. So maybe a little bit of context, we are not just based in Berlin, but we have our very first clinic is based in London, and our second clinic, which we're building at the moment, is in Portugal. So we're all across to be also catering to patients as we need. But my tech team is here in Berlin, and that for a reason, because those insights, that innovation, the passion, everything surrounding AI is really centered here at the AI campus. And that's something I don't want them to miss out.
it's still very helpful to know that if I need to meet someone in Berlin, that this is a great space. We can always have access to the community events that are happening. I've met colleagues and also potential collaborators through these events, and this has just been very helpful as a foundation. We can always also reach out to anybody in the Merantix community, and that's vast.
I believe what we will see in the next couple of months is that AI is getting deeper embedded in the specific verticals. So, for example, our company, we are AI enabled. We're not really an AI company, right? Because we are a healthcare provider, which is enabled by AI. I do believe that we will see more and more of that, because AI as a product, it's useless. You need to solve an issue with that, right? So let's find the issues that are solvable with AI, not just throwing anything there in the mix, but let's find the actually relevant pain points where AI can make a difference, and let's build the companies around that. Or bring AI into companies that are already solving problems, help them solve the problems better, to a greater extent, in a more efficient manner. Let's bring it to the space where we can actually make use of it. Ovom Care is a company in the space of reproductive medicine. Many countries in Europe have quite strict regulation when it comes to treatment options. Germany is one of them. Germany is not the best choice to be starting a healthcare company. Regulation-wise, there are a lot of stones on your pathway. But Berlin, specifically the AI campus that we see here, is giving us an edge. And it's giving us an edge from a technology perspective. We strongly believe in using technology to make the life of patients better. It is all about their experience. How do you feel when you go through your fertility journey? We need technology for that. We need the freedom, we need the innovation, we need the mindset to change that. And I do believe that Berlin specifically as a hub, and now the AI campus in the heart of all of that when it comes to AI, is giving us this ecosystem, and it's giving us a space, and it's giving us a location to actually do that. As mentioned, our tech team is based here in Berlin, and it will remain here in the ecosystem, to get those synergistic input, to be at the absolute forefront what is possible, and to bring then what is the newest cutting edge, what is possible to the life of patients, to make their life better. And that then, where this is happening, the treatment, it won't be based in Germany, at least not for now. It will be based in countries like Portugal, as we are at the moment, because from a longer perspective, for patients it's a lot easier, cheaper also. But we need the input from the technology ecosystem to be making the life of patients better. And that one we get from the AI campus.